everybody. So here, and we have a wonderful guest speaker. And when it comes to community assessment and certainly the MAP process, we couldn't get a better person. And if anyone knows how to engage with the community, Barbara's the one. So um, I'm just going to go. Barbara Grice is with DHEC, and she's been how long? You've been there a long time.
I've actually been there a little over 21 years.
Oh my goodness! Don't retire! Don't retire! Don't retire! So yes, so a wonderful resource. So I'm going to turn it over to her and make her slides bigger. She was worried. Oh, okay. Whoops. Let's get them back over here. Now, whoops. Make them bigger. Make them bigger. I got. Oops, we didn't sync them.
Yeah, I can. Oh, well, I had moved it forward. There we go.
There
That's
we go.
fine.
Okay. So it's moving. All right.
Well, hello, everyone. I am really excited to be with you this evening and talk about community engagement and community assessment, community health improvement. It is my passion. I talk with my hands, so I'll try to be careful not to wave them around on the screen. What I'll be talking about is just kind of walking you through what we do at DHEC and working with our communities across the state. And I'll end a little bit on the launch of our state health assessment process. So we're going to be kind of walking through that. Our role really with community health improvement is working with our four public health regions. We have community health teams in every region, and we have a community systems director who oversees that work. And I am the central office liaison to them. DHEC is a centralized public health system. We are responsible in my area for doing facilitation and training around community engagement. We do a lot of the data collection and analysis and reporting for the community work that we do. And then we work with our program areas to offer evidence-based implementation strategies. And of course, just looking at performance and quality improvement. DHEC itself, I mean, you guys know what we do, but we're around working for disease prevention and wellness promotion. We are the state's environmental and health agency. And one of the big strong pushes that we're seeing now is really prevention and working through our partners to improve health across the state. This is just a little bit about DHEC because we're a huge organization, and I think it's really interesting when you look at the way that we're set up and the breakdown for that. You see central office, and we have approximately 600 staff that sit within central office. And then if you look at just the Bureau of Chronic Disease Prevention, you see there are about 100 staff there, and that's where I currently sit. And if you look at our public health regions, there are about 1,600 staff that sit there. And then within my office, there are 3 of us, and I currently have a vacancy. So we have a lot of ground to cover and a lot of folks to serve within our area. We are in the process of forming a new bureau that will pull out and be health improvement and equity, and there will be a larger staff house there to address some of this work as it is becoming really precedent for the agency to be looking at community health improvement. This just gives you a little bit of the idea of the budget that we work with. The budget that you see is for the Chronic Disease Bureau itself. It's a little over $15 million, and a lot of that is in federal dollars. About 65% of the agency is funded by federal money. We have a preventive block grant, and that is what funds the community work that we do across the state with the public health regions, and it's at around $880,000 that's currently funding that work. This is just a little bit more about our area and how we serve the regions and work to really bring a cohesive approach across the bureaus and the regions and improve collaboration and communication. We are primarily responsible for technical assistance for our community assessment process, which I'll be walking you through, community health improvement. And we do a lot of the partnership development, both at the state and the local level, and we develop tools to really support the work that we're promoting across the state. One of the big things that we are super proud of that we have developed is the Community Health Improvement Toolkit. It's based on the National MAP model, which you guys are familiar with. And it actually came out of a grant effort that we were funded to do several years ago in partnership with the university, which was called the Community Transformation Grant. We actually then named it the Healthy South Carolina Initiative. We work very closely with folks here at the university and at DHEC and with other partners to develop the toolkit based on MAP to really guide the work across the state and kind of standardize the process that we use in every community. It also meets the IRS requirements for the hospitals. So it's currently used quite often to meet the China requirements for those nonprofit hospitals. The phases of the toolkit, I know that y'all seen these before. We always start out with kind of developing our partnerships. There's a visioning piece and then moving into the assessment areas. And we're going to be looking at those in more detail in some of the products that we've developed around community voices, our community health snapshot, and the forces of change. Of course, identifying strategic issues and then formulating goals and strategies, and ending with the action cycle and really putting things into motion at the local level. Currently, we have 45 of the 46 counties engaged in some phase of the community assessment process, but you can see that one pops out on the map, and there is no work occurring in Darlington yet. So we are working to get them on board, but everybody else is at some phase within the assessment process. And we have a reporting tool within our region work plan that I'm going to talk about a little bit more, so we can actually track what phase they're in and then the key products and things that are produced from that. So there you can see Darlington. Looking at phase one of the big successes that we've had in our partnership development and kind of looking at who's out there and doing what was working with Palmetto Health. We had the great opportunity to get on board with Palmetto Health's assessment process at the beginning of this cycle for their community assessment work. And Kelly and those were involved with that. We did some training with them. We actually helped develop a focus group toolkit for them and did a lot of the data analysis and work alongside with them to create a county profile that you'll see an example of. We participated in a lot of their action forums that they've since developed and put into place based on their assessment findings. So they've been a great partner and really an open door for a relationship between DHEC and Palmetto Health. So we still work together with them regularly and have a lot of conversation and networking with them, which has been great. Phase two is really the visioning piece. A lot of communities will have a vision, and this kind of helps them develop an overarching vision that really serves to guide the process. We like to kind of think of the MAP process as the umbrella that fits over a lot of the local coalitions, helps them develop coalition of coalitions, which is kind of a new term that's out there that helps them kind of come together and have a common purpose. Looking at the assessment phases, community voices, the community health snapshot, and the forces of change, this is what we're really proud of because we do a lot of work in developing and supporting our regions with this. One of the big things that we're proud of is some of the work that we've done with community voices and creating a survey tool. When we did CTG, the actual public health regions did surveys, but it was not in a standardized format. So we learned from that and actually created a standardized tool in SurveyMonkey so that we're all asking the same questions. And from that, we were able to develop and capture information. And I have some examples of some of the questions that are asked in the survey. Then we're able to generate reports both at the county level and the state level and use that data in a variety of ways. At the time that this was actually put together, we had about 1,000 surveys. Since the first of the year and the push with the hospitals to meet their requirements, we now have over 2,000 surveys in the system and counting because we're getting ready to use that as part of the statewide launch that we'll be doing as well. And I'll talk about in a little more detail as we move through. But this is one of the questions that you can see, and no insurance is a big issue at the local level for folks and looking at their health care and status. This one just looks at physical activity. And I love the number one reason why people really aren't physically active is personal choice. But we know they're being honest on the survey, and also it's good for us to know that because it really helps planning at the local level. And when they realize that, they know they need to make things more engaging. They need to help people kind of look at ways they can incorporate physical activity into their daily life and make it where it fits into their busy, active schedule. And crime is another issue in rural communities and all. There's been issues. They kind of look at that. They work with public safety to address that and use the information from the assessment to really make it a safer community. The next one looks at really the main reasons that prevent people from eating healthy foods. And then, of course, you can see what pops out on that one is, they eat fast foods regularly because of their busy schedules. Many people don't know how to eat healthy or it's too expensive. We're really amazed when we do our assessment work and all and find out how many people really don't know how to cook or prepare foods. And so one of the things that we've done is go back into our Bureau program area. We have a couple of programs that are in place with Cooking Matters and It's Your Health, Take Charge. And both of those teach healthy habits and cooking preparation. And also we're able to look at our assessment information and then kind of help match up with those programs that connect the resources to the communities. And Orangeburg is a great example of that. Orangeburg is where I started out, and that's kind of home to me. And one of the cool things that happened, I've been involved with their assessment since it was piloted in South Carolina, which was many years ago now. So they've done several cycles of MAP, and they just completed their assessment requirements for the hospital, and they're now launching their action plan. And one of the things that happened with that is they started community gardens based on what they learned from their surveys. They offer Cooking Matters. They actually did a Walking Wednesday event that linked the hospital and the technical college because they sit side by side so they can engage their professional staff and invite the community to participate. So they've done a lot of things, using the information and all to do that. Some other examples, PD Public Health Region worked with Clemson Extension, and they developed this beautiful guide that they use with their community partners to promote community gardens and healthy eating as well. Another example is Low Country in Colleton. They started with a really small plot of land, and then more people got involved through the assessment process. They had a lot of open community town halls to really discuss issues that they had identified through the assessment. And they started talking about, well, what are we going to do to really address this? How are we going to have an impact? And they started with a small plot of land. And look at this. They have just gone to new heights with it. They keep adding onto it, and it's huge now. And they have several gardens that are located in the area, and they're able to now share their food out with a lot of the local organizations to help feed people that are in need. They work with local churches to provide fresh fruits and vegetables to families in need. So this has been a great example. In fact, it's been showcased at several state level events and all, just to show how a small rural community can really take action and do it with very little resource. They partner together and kind of put things together, and everybody put a little bit at the table, and they came up with this wonderful project, and they've been able to sustain it over time. In fact, they're getting ready. They've got a site that's been donated to develop a kitchen for processing. So they're getting ready to do that in the community so they can actually process some of the foods. This is one of the other questions that just asked about, the 3 most important health concerns. I don't think any of these are a surprise to us because they match with the statistics that you see for South Carolina, but it does reinforce what the community sees as an issue. And these usually come out in the top 3, and occasionally we'll see other ones with teen pregnancy or HIV or other issues or accidents also come out in the top. But this kind of gives you an idea of what your community really thinks are issues to them. The hospital has used this information a lot to really target their diabetes and high blood pressure programs, especially to areas, because we can get this down to the zip code level when it's asked in the survey, so we can kind of tell where those pockets of areas where there's really a lot of problems, and also they can target their efforts with that, which has been really useful to them. This is just another example. We partner with Eat Smart, Move More, and they have done an obesity summit for many years. They are a very active partner with us. They actually produce the county profile and the infographics that you'll see a little bit later. And in fact, I was at a meeting early with Beth Franco, who is the executive director, and I was kind of hinting to her, I said, guess what, Beth, I've got something else for you to pilot. So they're a great partner, and I strongly encourage you to participate in anything that they have offered. They do a lot of training series across the state, and they do a statewide meeting and all. So they're an excellent resource, and their website is really great. If you want to check that out, you can just go to their website, and they have it set up with different resources and all that you can look at. And they have the Let's Go initiative, and it maps out a lot of the resources and things that are available across the state as well. So they're an excellent partner and a resource. This is just another example of the question that asks the overall health of the community. And I'm always intrigued when we get this back, because communities really don't see themselves as healthy. They rate for this one as fair, and that's pretty typical. It's sad to say that most communities really feel like there's a lot of room for improvement around their health. Their biggest concerns are access to care and making connection to local resources. So that's one of the roles that we try to play with DHEC, is really the community and clinical linkage piece to help get people connected to things that they need to improve overall health status. The community health snapshot is another thing that we've worked on, and I'm just going to kind of move ahead because this is what I really want you guys to take a look at. This is our county profile. And the county profile is put together to really show the demographics for DHEC. We pulled a lot of our data, and how it really came into play was that a lot of people began to ask in the community, how do I find data? And to be honest, the DHEC website is difficult to navigate. So when they wanted to look for basic information, they had a lot of trouble finding it. So we actually pulled together a team and developed the county profile so that we could put that information in an easy to use format for communities. And it is housed on scaledown.org. You can actually go to the website. There are about 23 counties that are currently live, and there are several more that are coming on board, and some that are being updated due to the recent assessment work with the hospitals. But they're there, and you can access them. And a lot of folks use them with their county planning. They use them with their coalitions to kind of look and track, and match their activities to that. So we've been really pleased with the outcome of developing this product, and the fact that people really use it and are able to educate their local community about some of the health issues that are occurring there. The front page is the demographics and a lot of the information from DHEC. And the back page, if you look at the top of it, it actually captures that assessment data that we were talking about and some of the key questions that we were just reviewing. So they have a snapshot, and they get to pick. We kind of have a menu where they can select like the top questions that they would like to feature at the top of their profile. And then they also work to select their action items that are included at the bottom and all, so that they can highlight some of their local efforts and all, and show their successes, because we really want to praise the work that they're doing. And this is a good way to showcase the data and the work that is occurring. Looking at the forces of change, that's really a SWOT analysis in a simple term, and we do that a lot with our community groups, just to kind of do a check-in to see where they are, to see where they have strengths in their local community, where their weaknesses and opportunities and threats. I had the great pleasure of working with the Healthy Tri-County Network, and they're in Charleston. It includes Berkeley and Dorchester. And I just did the forces of change with two of their big work groups. They have two work groups that they formed to address their assessment process. They have a data work group and a community health improvement plan work group. And the way that that came about was they were out doing assessments a couple years back, and they realized that Roper was doing one, MUSC was doing one, DHEC was doing one, United Way was doing one. And they all kind of looked around and was like, maybe we should work together and create one comprehensive assessment. So we really use the forces of change to kind of initiate some discussion and talk about how we could bring some of that together and really look at what's impacting that, because there are a lot of things at the political level, economic level, that environmental, that have some impact on the way that things occur and work that's done in the community. So that's been a great learning process. We also used it to shape their health improvement plan work group, and really how they want to move forward and kind of look at what strengths are in their community and how they can build on it. what are some of the weaknesses that they have and where they feel like they'll need technical assistance, and then opportunities and all that they see that they can really partner and move forward. That's a little twist on it because normally it's done with community groups. But that was me being a little creative and using it as an internal tool. So when you look at MAP, you can apply it in many, many ways. And that's one reason I kind of shared a little different example for that, because you can use it in the community to help them gain insight, but you can use it internally as well with work groups and other people to kind of get them to think through process and look at things as well. So in fact, we're going to be doing the forces of change at the state level for the state health assessment, and it will be done with key partners that will pull together and actually take them through the forces of change and looking at that and having discussion and really looking at how we want to shape and use that information as part of our overall assessment work. One of the tools that we developed, because we began to look at our coalitions and we're like, gosh, you know, people keep kind of asking questions about our coalitions, and we want to know how engaged are they really in the work at the local level. So once again, we partnered back over with the university to help us really look at and take an in-depth look at developing a tool to really measure community engagement. And what it does, it looks at the partners that are involved, who's around the table, are the right people there, are they just there to be participating, are they just listening, are they an active partner? So it measures kind of where they fall on that spectrum and the work that they're doing and the commitment they have to the process and the coalition. It actually has domain areas. So when they go through, there's a tool that we use, and it's facilitated by one of the DHEC staff people or someone on the coalition if they're comfortable with it, to kind of go through the tool with the coalition group, and they really look at, you know, their leadership and how inclusive they are of the community. They look at their organization and some of the pre-existing networks that they have in place. They look at their community needs assessment. They look at management and resource mobilization, and from that, there's a score that's generated, and you can see the spider diagram that's there that kind of lets them know where they fall and where they have weaknesses or areas that they would like to work on. The communities love this. They really love it. They don't, we were afraid they might see it as a scorecard and kind of think, well, gosh, they see it as a planning tool and they get all excited and they can't wait to complete it. And we actually generate back a one-page worksheet for them that summarizes everything, and then we get them to come up with 3 action items that they want to work on. And that really makes it easy for them to take it back to the community and say, hey, this is where you scored, and then here's some things that you said you wanted to work on. And I had the really fun opportunity to do it. I did it with Fairfield, and there were 30 people, and we did a facilitated version of it and had a great conversation and dialogue. But what it did was position them to go after the Healthy Carolina grant, and they got it. So it was quite beneficial that they were able to kind of look at their infrastructure and position themselves, and also learn more about how they functioned and worked and the resources that they had. The next piece looks at strategic issues and really developing a prioritized list of the most important issues that are facing the community. And that's where they really start moving into action. And that's where we kind of come into play to help them think through that and what's really doable at the community level. And then also thinking big picture of what they can link back into within DHEC and the program areas that can support their work around those strategic issues. They move on into formulating goals and strategies. That's where they really get into looking at how they're going to move themselves to action with specific goals, and then strategies and ways that they're going to measure that work. We have several different templates and TA that we can provide for that. I'm currently working with Charleston again. In fact, we have a small work group that we're looking at exactly how we want to formulate the community health improvement plan and structure those things so that it can be a reporting tool and a planning and working tool for that group as well. So there are a lot of neat things that are kind of going on with that. And then just looking at the action cycle is just really kind of pulling all the pieces back into play and making sure that everything is working in a cycle so that you're continuing to plan, implement, and evaluate your work as you move forward. I like to think of MAP and the whole process living and breathing, that it's something that's going on continuously, that we go back and look at information and make sure that we're on target. We may decide to go back into the plans and kind of adjust the action items that we've come up with, or we may see that the community is shifting in a little bit different focus, and we can always align ourselves and kind of move accordingly. We can even get additional data if that's needed to support that work. So it's not something that once you've done it, you're finished with it. It's always living and breathing, and it's really a tool for the community to move themselves to health improvement and action so that they can have positive health outcomes. The community health improvement plan, just kind of summing everything up and developing that plan of action. It's definitely community owned. At this point, they're invested and they own it, and they're the ones that are really responsible for the work and moving it forward. That will be occurring at the state level as well. So we're in the process of kind of developing those pieces, getting the players around the table. We'll have priority work groups just as the communities do. So once they kind of come up with their initial priorities, they'll have their priority work groups. They'll do the same thing the communities do. They'll start to look at that. They'll develop their goals. They'll develop their objectives and strategies and metrics to kind of measure those things. So it's going to be neat to see the alignment between the community work and the state work, and the community plans will feed directly into the state health assessment and state health improvement planning process. We will use the data that has been collected at the community level, and it will support and inform the work of the state plans as well. And then just to talk a little bit about our region work plan, internally for DHEC, like I mentioned, we have those community health teams. We developed a region work plan to support our work, and it just goes a step farther. It takes the community assessment work we do and it links it to those Bureau program areas and objectives, and the work that they're funded to do, so that we're able to actually kind of look at key objectives for each of the program areas around obesity, physical activity, nutrition, injury, cancer, heart disease, diabetes. So each one of them have objectives within that region work plan, and we're able to kind of track and monitor that information, and then we're able to compare it back to the work that we're doing in the community. This is the 2016 region work plan breakdown, and we had 77 objectives. This year we have cut it down to 51. So we are happy that we are kind of condensing and learning and growing with that. And we are currently reviewing it. We have a mid-year review on it. So June is our mid-year review, and we've actually managed to consolidate a couple other objectives and kind of retooling that to match the alignment with some of the work that's currently taking place. This is just some examples of success stories that have been taking place over the last year. This is Colleton County again, and you can see just kind of where they are and then how many people that they reached. I think it is so cool that they provided fresh produce to at least 500 residents. So you can really see that they have had a huge impact with the work that they've been doing. This is Midlands, and HYPE is actually comes through Eat Smart Move More. So if you want to learn more about HYPE, you can go on their webpage. There are several HYPE teams across the state, and they have been linked in Fairfield. In fact, they were part of our community assessment work, and a lot of the youth went out and actually conducted some of the surveys in the community and all to get a better idea about what some of the issues were, and they did a photo voice project so that they could get pictures and kind of see what their community looked like, and really came back and they actually presented. But at that time we were funded for CTG, so we had the HYPE team present for the CDC site visit, and that was awesome. I mean, they did a fantastic job. They got up, they presented their information, and CDC was quite impressed with the youth and the work that they had done there. So we were excited to showcase that as part of the work that we did with CTG. And this is just one of the examples from Midlands. public health region, and really what they were focused around, say no to drugs and violence, and yes to healthy eating and active living. This is an example from the PD Public Health Region, and Lee County has done some incredible work. Lee actually had two functioning high-level coalitions, so they were both doing work. They finally decided to have a joint meeting and come together, and lo and behold, they actually have now formed one group. So they function as that large overarching interagency council. And once they kind of all started talking and working together, they realized they were doing a lot of the same things. So they've been able to consolidate resources. And as you can see, they've done some really neat things. They've done a lot around healthy eating and active living. They've partnered with Clemson University and the Department of Agriculture to kind of do some training for local residents and farmers. And one of the neat stories that I have for there is there was a farmer, and he grew collard greens, and he had acres and acres of collard greens, and he would box them up and give them away in the community. And so word traveled very quickly about his efforts and all, and he's an active member of the group, and he's really been vital to kind of connecting to the grassroots and getting the other farmers on board, and he's been part of that training effort. So he was kind of the person or the gatekeeper that got them connected to the farming community and got them engaged. So that was really a neat way that they approached that, and they were able to kind of pull in healthy eating and encourage the active lifestyles with that. The upstate has been working closely with their schools and all, and kind of looking at ways to promote physical activity, and they know to Cherokee County, and they've been working on to reduce obesity rates and unhealthy environments. So a lot of work has taken place with that. They do a big walk to school day event with a lot of media coverage for it and all, and they've really been promoting that. And each year they get more and more people involved, and you can see they had 400 participants at the last event at the elementary school. So just in summary, that's kind of what we do. And all of our work aligns with public health accreditation. That's something that we are now pursuing with DHEC. So it's really exciting to me to see how we fit into the big puzzle of that. The community work and the state health improvement work is a requirement for the accreditation process. So we've been working to document our activities, which we keep a lot of reports and databases and all. And we're excited with the future of the development of our state health improvement plan and our state health assessment. So right now it's kind of exciting times for us to really see everything come to fruition with the work that we've been doing. In fact, we're hosting a big meeting on Friday to showcase our regions and their community engagement work. They're going to be presenting to some of the other directors within the agency to share kind of the work that they've been doing at the local level and showcase some of their communities and efforts, just like we've talked about here. And that concludes my presentation. I'll be happy to take any questions and share any additional information that I can.
Thanks, Shayla has a question. This is where I was talking about. It takes a while for that.
And while she's typing in, I will tell you one of the other products that we have produced is a region snapshot, and it actually rolls some of that county profile data into a region snapshot, and it includes information, additional DHEC data, and the social determinants of health. That is also available on Scale Down. There's a region snapshot button there that you can get to that information. And on Scale Down, if you click on the resources tab, there are a ton of toolkits that have been put together. Lori Phillips and her staff do a fantastic job, and there are several toolkits that are there around active living and pedestrian planning and all. So those are available on that website as well. Some of her ACE communities, which is active living profiles, are available there. And the farmers market inventory is also available there. They've done a great job. They have an app that's available that you can click on, and it's on the website as well. You can click on that link and it will take you to the farmers markets, and you can see where they are, their hours of location, and accept SNAP or EBT. So that's a huge resource that we use a lot with our community assessment work to kind of point people in the right direction to where they can access healthy foods.
Did you see Shamika's question? How did you cut down the objectives this past year, and will you be cutting them down again?
For the region work plan, we host a series of meetings. We have about 15 folks within our program area, and then we have at least 2 or 3 representatives from each region. So it's a group of about 25 or 30 people that get in the room and actually review the objectives, and we have discussion about those. We talk about ways that we can combine across programs, which has been really neat because cancer may be doing something to address healthy eating as well as somebody in diabetes. So we've been able to kind of link some of those objectives and combine some of that work, which is really what our role is to help people better coordinate and consolidate some of the work that they do so that we can have a more concise approach in our communities and all. We try to cut down on the amount of staff from central office going to the region and be more coordinated with our efforts with that. So that's kind of what's driving the reduction of some of those objectives and just looking at better ways to coordinate the work that we do.
Dawn had a question. So Dawn, are you thinking of like when the communities come together to?
Yeah, that's what I was wondering. What exactly are you thinking about in our communities? I can tell you that every community is different. And for doing community work, you have to be really flexible because sometimes the process will move quickly and sometimes it does not. It kind of depends on the community and the dynamics of that. Typically, the process itself takes 12 to 18 months to go from the assessment to the development of a health improvement plan. Some communities move a little quicker, some move a little bit slower. It depends on the coalition and the lead that's doing the work and how they like to do the work. Some of them like to do full committee work, which I facilitate a lot for the full committee groups, and that's 30 plus people in the room, and that's facilitating a discussion around a particular topic. And you really do need a facilitator to handle that, and they like to bring in folks for that. Some of them will do smaller work groups where they have a smaller number from 8 to 10 that are actually in the work groups, and they'll work on a specific topic and then bring that back to the large group and then have some discussion around that. But all of our DHEC folks are trained in facilitation and helping to guide those meetings, and they provide a lot of the technical assistance with that. As far as having to reprioritize, sometimes you do, as I mentioned, it's kind of living and breathing. So with Orangeburg, they went through the assessment process 3 years ago, and then they did check-ins over time. And then this time, they're actually the order of what was a priority changed for them, and it was because of some of the past work that they had done. And they realized that, that the check-ins are really important because sometimes you do kind of have to shift direction based on what those community needs are, because that's what the process is all about, is really addressing the needs and the priorities of the community and then matching your resources to that. Unfortunately, many times with small communities, they're grant driven, and DHEC has been known for that in the past. We kind of come out there with a grant, like, hey, we got some dollars, we need to focus on diabetes, and then that grant will go away and the topic of the day will change. So the assessment process is something that we really promote so that those priorities are set by the community for the community, and let that guide the process and then work backwards from that to then align the resources.
You don't go in with
that.
preconceived priorities.
Yeah. Yes, we always want the community to be the ones that own it and drive the process and let them pick the things that they feel that are the priorities, and not have it prescribed by an outside organization.